Hello, residents of Cypress Village. This is Ty Morgan, Executive Director. Please listen very carefully to this message as it contains important details related to how we are going to operate over the next 2 weeks. Based on the positivity rates in the county and within the community of Cypress Village, we are taking precautionary measures to keep our residents and employees safe. A written distribution will come out Monday evening with the specifics for activities, dining services, housekeeping, maintenance, and any other support service we provide. All of the measures we are taking will be in effect for a 2-week period and will be reassessed at that time based on any progression or regression. A community weekly update will come out in addition to the one you receive tomorrow evening for the next 2 weeks. Coffee chats will now be virtual. If there are any significant events or messages that need to be conveyed to residents or family members in between, we will communicate via call them all. At this time, all residents will be required to wear masks for the next 2 weeks in common areas, regardless of vaccination status. Most of the positive residents and employees at this time that are positive were all vaccinated. So we must remain vigilant and as safe as possible. All offices will be closed to residents and others during this time. If any resident or family needs to contact any director, manager, or department, please do so through the telephone or email. The Wellness Clinic will remain open for scheduled medical appointments and services. COVID-19 testing options will be available through HealthLink Diagnostics. Details will be forthcoming in Monday's written communication. In the meantime, please do not come up to the security office or to the towers for a rapid test if you are not feeling well. Contact your medical provider or call the Wellness Center or Susan McLean in Resident Services to help you coordinate the care you may need or the tests you may need. Visitation for skilled nursing, healthcare center, assisted living, and memory care. Only compassionate caregivers will be allowed to visit indoors. Compassionate is limited to end-of-life or bedbound patients or residents. These must be approved by the healthcare administrator, assisted living manager, and memory care director. That is Stephanie Markowski for healthcare, Victory Sloan for assisted living, and Robin Khalil for memory care. Visitation will be limited to one visitor at a time. All visitors will be required to wear a mask and a face shield. We will provide one warning if the policy is broken. If it is broken more than one time, we will be forced to bar that visitor. Cypress Village residents with spouses have to follow these same guidelines while visiting their loved one. Independent living visitation. Visitors will not be permitted in the building at all. If prior arrangements were made with a family member coming to visit you and cannot be changed, please email the COVID-19 email to request that they be added to the approved list. All visitors who are approved to enter the building by exception may not congregate in any of the common areas and must wear masks at all times. And we would ask that they stay in the apartment of the visiting resident as much as possible. Residents may self-organize visits outside of the building. We will not be scheduling outdoor visits for independent living. Independent living can organize themselves. This will only pertain to skilled nursing, assisted living, and memory care. Activities and community life services. Fitness classes will remain as scheduled, but residents must wear face masks during the session. All other resident activities for groups are going to be canceled at this time. Any that can be successfully converted to virtual, we will accommodate. More More details in upcoming distributions. Resident self-organized groups who come to meet must wear masks and socially distance. Transportation services. All transportation will be strictly limited to medical visits only. Any grocery trips will still go as scheduled. However, we will have to limit the number of residents on the bus at one time, and masks will be mandatory. Housekeeping services. All housekeeping services will be canceled for the next 2 weeks to minimize any contact or any potential exposure in independent living. Emergency services can be requested by contacting the housekeeping office. A sanitation and ultraviolet light schedule will go into effect for all common and high traffic areas, effective immediately and ongoing. Maintenance and plant operations. For independent living, only emergency work orders will be completed inside of homes to minimize contact and limit potential exposure for the next 2 weeks. Dining services. Effective Wednesday, dining venues will be closed for dining in for the next 2 weeks. Pickup and delivery options will be available for the main dining room and the loon's nest. Delivery charges will be waived for the next 2 weeks. A drop box will be placed at the hostess stands for apartments and at the boathouse for houses by Tuesday morning. Residents may drop off their weekly menu selections to that designated drop box. If residents are unable to physically drop off the menu selections, please contact 807-6134 to place your order via phone. Details will come out in Monday evening's distribution. Communications. A written distribution will come out on Monday evening, as mentioned previously, laying out all of the changes that residents can anticipate over the next 2 weeks. A weekly community update will be reinstated for the next 2 weeks. Coffee chats, as mentioned previously, will be done virtually. All COVID-19 inquiries must be emailed through the COVID-19 email account. I know some of you are feeling a little upset about the message that I just provided. However, based on everything that is going on that occurred within the last week and the spikes that we are seeing throughout the county and local area, this effort is absolutely necessary to make sure that we keep all of the residents and our employees as safe as possible. Please be patient and supportive of this decision. Thank you all.
Cut.